159 to 3,897 as of today. And ICU bed capacity is predicted to be met by November 30th, and I'm going to show you a little bit more of that in the next slide. According to the IMHE modeling, ICU bed capacity as of today, you can see where today's marked, and just a few days hitting November 30th, we're supposed to meet our capacity, and then we're supposed to be over capacity from that point basically through March. As you can see where it says December 28th, we're looking at almost double what our current capacity is for ICU beds. Next slide. Hopefully on the mitigation front, some of these things will help us with that. On November 22nd, Moderna announced they will be submitting their vaccine candidate to the FDA for emergency use authorization by the end of November. The FDA is expecting to review Moderna's application on December 17th. November 23rd, Pfizer estimated that the initial distribution of their vaccine may be approximately 6 million doses nationwide if the EUA is approved by the FDA on December 10th. This is significantly less than initial estimates. We're seeing things like 2 shipments of 97,000 possibly to Pennsylvania. We're still waiting on what those numbers will actually be. On November 24th, today, AstraZeneca announced their vaccine candidate was 90% effective at fighting COVID-19, and the vaccine will only require refrigeration, not the extreme cold storage required by both Pfizer and Moderna's vaccines. AstraZeneca will now immediately prepare regulatory submission of the data to authorities around the world that have a framework in place for conditional or early approval. Pending any of your questions, that's all I have.
Great, thanks, Mike. Any questions for Mike on that slide? Okay, so touch base on a couple things. So the Long-Term Care Task Force, I think most everybody's pretty familiar with that, but just to make sure, I'll give you a little bit of background. So it started the Long-Term Care Task Force a few months ago, quite a few months ago now. And it's sort of Department of Health, PEMA, Department of Human Services, DDAP, Aging, and the Ombudsman's Office. And the primary purpose originally was to prioritize and coordinate the limited resources we had through one of our contracts with GHR as well as the National Guard, you know, to put into sites. And I know down in the Southeast, like Broomall and some of those facilities way back when, you know, where crisis events would creep up, we'd have to really prioritize to see which ones we were going to support. We have a lot more resources now with the RIC-P program. We've expanded the GHR contract significantly. We've also let contracts with Eurofins and CVS to do testing in long-term care facilities and whatnot. So we now have a much broader range of resources, but the process still remains pretty much the same. We meet several times a day, at least twice a day, to discuss long-term care facilities, where we're putting resources and those types of things. So every day, the area office, Tony, sends out an email in the afternoon, and that's really what the RIC-Ps are doing statewide. It's a spreadsheet that's drawn from a WebEOC database where we monitor all that activity. Today we had a meeting early this morning where between the National Guard and the RIC-Ps and GHR, we've done over 10,000 assignments within the 2,000 and change long-term care facilities in Pennsylvania. So it's a pretty active group of folks, and they're definitely out there doing a lot of work. But anyway, so that information will come out every day from the area office, from Tony and his folks. But if something is looking like it's going to become what we would refer to as a crisis staffing, where the RIC-Ps don't have the ability to manage it within the program any longer, and we have to look at external resources like the National Guard or something like that. If it comes up to that, you guys will definitely get an email from me to make sure that everybody's aware that we have the National Guard going in and stuff like that. But otherwise, it's normally, like I said, that routine email that comes out every afternoon from Tony and his folks. You also may be aware that the RIC-P program was a legislative program that is slated to end the end of the calendar year, so the end of December. And also the use of the National Guard on Title 32 orders is slated to end the end of December as well. So if you saw some press releases recently from the governor's office and a variety of other things, you know, we're actively working with the legislature to look at potential expansion to that program or other means to fund the RIC-P program, as well as working through our federal partners to be able to get extensions to the federal orders for the National Guard folks, or look at other courses of action should we need to, should we not get those extensions and we need to continue those services. So any questions on the long-term care task force and the response of the long-term care Obviously, that's going to be a serious concern, as we move forward because a lot of the growth, especially in the fatality area, is still coming out of long-term care facilities. So any questions on that? Okay, move on. So the C-REACT, some of you may be familiar with this. This was a team that was developed primarily the Department of Health. We support that through PEMA. There's other state agencies that will support that as well, such as Department of Education and whatnot. But it's the COVID response for emergency assistance to counties team. And it was developed off of the CDC CRAFT team model. I don't know if any of the eastern counties were visited by CRAFT teams, but I know the Alleghenians and western counties had been visited by CRAFT teams from the CDC before. But basically, it's a group that's led by the Department of Health Intergovernmental Affairs Office. And it normally looks to reach out to key stakeholders within the counties to look at what's going on, what are their concerns, what types of state resources can be leveraged to support the counties. And when I say resources, it's well beyond, what we would consider traditional emergency management resources. So there's varieties of things that they'll bring into that, talking to chambers of commerce, talking to the universities and those types of things. But a lot of times there will be things that will fall out of this that are emergency management related, such as community-based testing programs and those types of things. So to date, we've done a few of them. Lackawanna in the east. I know they're wrapping up their AMI site recently. That was a fallout from the C-REACT meetings that we had. We met with the city of Scranton. We met with the county, the University of Scranton, quite a few other folks up in that Lackawanna County area to figure out what the issues were and how best the state could support them. So there again, if you do get a reach out call, probably be from Kristen Faust or Megan. Megan's last name just fell off my head, but anyway, it'll come back to me. Megan from the Department of Health Intergovernmental Affairs Office. They're the ones that take the lead for that C-REACT. When we're dealing with county commissioners or county EMA or anybody else, normally the area office, Tony or one of his staff, as well as either me or Jonathan or Bob Miner will also be on those calls as well. So any questions on the C-REACT? Just want to make sure everybody was familiar with that. Megan Abbott's the other person. Thank you. Any questions on that? Okay, slide please. So thank you. Yeah. Here's Molly. So I'd mentioned the AMI testing. So there again, this doesn't have to be a fallout of the C-REACT. It just naturally comes up when we do the C-REACT reach outs. But the Department of Health led a contract with AMI. It's a private corporation. They're international. They've done a lot of work in Africa with disease outbreaks and stuff. Definitely do a pretty good job of developing out community-based testing. But the contract that the state pays for covers for a week of community-based testing. When a county is identified as being in the queue for testing, there again it'll be a reach out primarily from Danielle Pierre from the Department of Health. Normally the area office and the PHPC, as well as somebody here from headquarters, either me, Bob, or Jonathan, are normally on those initial reach out calls to the county commissioners, so they approve it. And normally it's assigned to the county EMA to be the lead for it. Now, not always. Center County assigned it to their chief county clerk, but mostly it's the county emergency manager is the one that gets the rose pinned on it for that. And then usually it's turnkey. There's a fellow named Skylar that works for AMI. They'll deal directly with the county. Normally they ask the county to find the site that it's going to be done at, but pretty much everything else is turnkey. They bring everything else with them. They bring the staff with them. They take care of 99.9% of the business. Normally the only thing the counties are required to do is come up with a site, and they ask if you do have the ability to help them with some of their biomed waste. It's small. It's like a trash bag size biomed waste, to help out with that. But if not, they can work all those issues themselves. They do have a plan. Originally, Department of Health's plan was to, look at the counties that were transitioning from, moderate to substantial. And then they would reach out to see if they wanted the testing. Well, now that everybody's gone exponentially substantial, they sort of just have now got a scheme that they have laid out that they're working on. And then they just go from county to county and do these calls to the commissioners. and figure out a time that's set up, that makes sense for the county. I think they've got 3, we had calls with, Clinton County, Warren County, and some other county, and Greene County, just this week. So I know,
Wyoming County as well? Did they do Wyoming County?
yeah, it might have been Wyoming County as well. I can't remember off the top of my head. But there's sometimes 2 and 3 calls a day as they're doing the reach out to get these things scheduled. So there again, we've had a lot of positive feedback for the most part. It's a good program. They've supported, I would say 500 tests a day, I believe is what they can support pretty easily. So if you do get a call, generally it'll come from Danielle Pierre from the Department of Health. Definitely take that call and set up the meeting. I'm just looking at the chat box.
North City Task Force DOA just had a meeting this morning with
Yep.
regards to AMI.
Good deal. Okay, guys, yeah. So good deal. Yeah, like I said, it's a good program. So, definitely would recommend it if, once you get the call to take them up on that. So, any questions on the AMI and the CBTS, the community-based testing? Okay, slide please. So alternate care sites, I don't know if it came up on every IST, but I know it came up on at least one of the ISTs. So if you guys remember in the spring, we did the Lawrence Center out in Allegheny County. We did we didn't do it. Philadelphia did the Leah Core Center down at Temple. We did the request for the FMS to support it. And then the state set up the Glen Mills School in Montgomery County, Delaware. Chester, wherever that is, it's all over, whatever county that was in, Glen Mills. Chester County maybe. And then also the East Stroudsburg site up at the ESU. And, we learned a lot through the AARs of all those sites and whatnot. And going forward into the spring, or into the fall here, the primary focus of medical surge for the Department of Health is to look primarily within systems. So as an example, as hospitals, cancel electives and different things like that, looking at existing bed space within the hospital systems so they can move patients around, developing out a plan so they can move patients not just in system, but out of system into other hospitals that are geographically close and those types of things. What they found was in the spring was that although the Joint Commission sort of had a requirement of Delaware County, thank you, had a requirement of I think 125% of the bed capacity, was available in ACS. What they found was there was actually much more of that. So that's been the primary focus of the Department of Health, both for acute care within the hospital as well as subacute in skilled nursing facilities and long-term care. So many times when we've been lately decompressing long-term care homes to free up, so the staff ratios are good and whatnot. Country Meadows may have X amount of beds available within a certain geographic area, or other corporate level nursing homes have beds available or wings that are open where patients can be moved to decompress the existing facility. So that's been the focus of medical surge planning for the fall. But because we know that if things really get bad and we exhaust that medical surge capacity, there still may be a need for what we call the gymnasium style ACS. We still are planning for that. So primarily FEMA's working with Department of Health and developing out, just potential sites that could be stood up if need be for anything from smaller sites in around the 50 bed range using MSECs and those types of things to the larger sites that we would use like an FMS and whatnot. There again, we're not really dealing with any of the hard parts, which are the staffing, the wraparound services and whatnot. That would still fall to the Department of Health to work those things. But as a contingency plan, we have been working on just generally working through the concept for standing up, the gymnasium style sites. So, any questions on the ACS? Next slide, please. And then the Joint Rapid Response Center, I think everybody's pretty familiar with that. That's the support we've been given to the superintendents and the IUs for decision making in the K through 12 school system. So, there again, that system's working reasonably well. We get, probably 10 to 15 calls a day into that system for really it's just primarily superintendents looking for advice or interpretation of how they're interpreting the Secretary of Health or the Secretary of Education's orders regarding schools. Like I said, yesterday and today were pretty busy days because of the new order that came out as schools look to interpret the new order on schools with the attestation policies and whatnot that came out. But like I said, that's a joint initiative that we work with PDE and Department of Health on. The call center itself are state employees. They run an extended business day, and then after hours, our watch picks up any calls that would come in from the school during after hours and then routes it to the appropriate people for support and decision making. So I just want to make sure folks had knowledge of the JRRC and what its purpose was. See if anybody had any questions on that. And there again, as we move forward into the fall, as the governor's office and others make changes to policies, there again, these are the groups of people that here at the operational level that field those calls and help try to support decision making in the schools. Rob? The mortuary resources, there again, wanted to touch quickly on that. As you probably recall, we acquired 33 commercial 8x40 reefer units early in the pandemic back in the spring. And we decentralized those. Originally, they were all staged out at 40 Town Gap, and we've decentralized those. Primarily, some are staged at some of our state prisons or at our state DHS state facilities scattered throughout the state. We also have a couple that are currently in service up Montour County, up at Geisinger, there's a unit in service, and I think down Delaware County, we still have 1 or 2 units in service down there. But just want to clarify that, you know, these were really always intended to be more for last resort sort of long-term use. That, you know, these are intended to be hardwired in, not sort of plugged in, but are commercially hardwired in, find a spot for them, and they're going to be there sort of for the duration. So, you know, as you guys are looking at your mortuary planning and as you're looking at the potential need for these types of resources, you know, look first to the normal plans that you guys would execute with your coroner's office and those types of things. But if it is, you know, Montour was 2 containers, Delaware. Montour was a good example of, you know, Geisinger services quite a few rural counties that don't have a lot of capacity for morgue storage. So, you know, that was a facility that can easily become overwhelmed because of the number of counties they're serving, the number of nursing homes that they service as well. You know, and all those folks tend to end up at Geisinger and in their morgue. So, like I said, as you're looking at your plans for mortuary services and mortuary resources, like I said, these are really intended for long term. So if there's a large capacity need long term, that's the intent of these. So any questions on the mortuary stuff? Okay. So just a couple other planning considerations, and I think some of the other staff will touch on this as well. So first is requiring PPE, as Director Padfield has mentioned on the ISTs and in a few emails. You know, the goal is for folks to have a good cache of PPE coming into the fall in this resurgence. So whether it's the state purchasing it or at the county level, you know, using your CARES Act dollars and whatnot to purchase PPE. You know, this is going to become important as we get further along into the pandemic. I think Eric's going to touch on this as well, but you know, the RICP program was funded to purchase and deliver PPE to nursing homes, long-term care facilities, right? Skilled nursing and assisted living and you know, those types of things, personal care homes. So, but there again, that program is looking at, you know, coming to an end. So, you know, while we're trying to get the hospital systems to purchase as much PPE as feasible as we come into the end of that existing contract period, it's just something for folks to remember that, you know, if we don't have a good cache of PPE as we get into the January timeframes, we're going to be back in the same boat that we were back in, you know, the April timeframes with folks being on crisis standards of care and trying to reuse stuff that they should be disposing of. So just a reminder to make sure we're looking at acquiring PPE as we come into it. The crisis staffing plans, I think pretty much everybody's probably already all over that. I know we've had COVID outbreaks in courthouses where EMs are located at and 911 centers and a variety of other things. But just to make sure that, you know, you dust off those crisis staffing plans so that if you do have COVID run through your emergency management organization or any of your essential employees that, you've got some means to do crisis staffing if you would need to continue your operations and as well as dust and also your COOP plan so that if you do have to vacate your facility so it can be, disinfected and decontaminated over a period of 2 or 3 days, that, your COOP plans are up and running and can be feasible to implement. And there again, I know I'm probably preaching to the choir. Most folks have been doing virtual work and exercising their COOP plans for the last couple of months because they got people off site. But if you haven't, it's a good time to take a look at that. Kind of already talked about the mortuary affairs stuff, and I know Eric's going to talk about that a little bit more when he gets into his section on logistics and whatnot. But there again, we do know that there's a natural progression. You saw Mike's slide that looks at the total number of cases. So we know that there is a 10-day to 2-week span between a peak in cases to a peak in ICU and ventilator use to a peak in fatalities. It's a natural progression of folks that aren't doing well with the disease and go on to die. So, as we looked at that period of December 28th for a peak in ICU cases, we know that we can look probably 10 or so days after that, and we'd be looking at, probably starting around a peak in death. And if you look at the IHME site, you'll see where that sort of corresponds. And, currently the projections are going to be a bit higher than they were at our peak in the spring, and they're also going to last longer. So before we were over 100 fatalities a day for about a 28-day period. The current models are looking at being over 100 a day for more like a 60-day period, I think it is, if I remember correctly. It's about 2 months as opposed to 1.
A little bit longer.
Yeah, so definitely, time to really make sure our mortuary plans are in good shape. The potential impacts for the future lockdowns and whatnot, the biggest impact there probably is on your staff that's traveling over the holidays, whether it's the Thanksgiving holiday or the upcoming Christmas holiday or anything like that. The restrictions from coming back into the state, the requirements to be tested before you come back to work, all those different things. Just make sure that as you're looking at what your staff's doing, where they're going and stuff like that, that you sort of factor some of that stuff into to that. That also, as we know, affects a lot of the second, third order effects of a lot of those mitigation criteria affect us as well. With if you go to a grocery store today, you're not going to see as much stuff on the shelves as you did a couple of days before the latest order came out. I just had our folks touch base with the feeding task force today to see how things are going, because you see a lot on the news about feeding shortages and stuff like that. And they say, kind of right now, they believe they're holding their own with the food banks and everything like that. But, as this continues on, that's not necessarily going to be the case. So, as we look at lockdowns on different things, that's going to affect people's ability to purchase stuff, including food, shipping food, all that different stuff. There's impacts to the supply side of that. So there again, just thinking through those things that could be impacts that could affect emergency management and the role that you guys play. And then lastly, is the vaccine distribution. We had that call on Friday, and while the Department of Health has a playbook more so than a plan, but conceptually they have a good sense of where they want to go with vaccine distribution, how that's going to work with the federal entities and whatnot. But it's not the detail level of plan I think that most people would like to see. And a lot of that just has to do with there's still quite a few variables from the federal government that we don't know to be able to add a lot more fidelity to that plan. So as the Department of Health had mentioned on the call, it's likely that counties will become involved to some extent, especially when we get into the mass vaccination centers, the pod-style centers, and those types of things. Whether it's in, volunteers through your CERT-PA, volunteer registries, whether it's in, basic logistical support for signage or any of those other things that you guys would normally be involved with. I think that is a likely thing to happen. So, I know some folks have been directly working with, whether it's Bob Pish or Katie up in the Northeast on, pod plans and mass vaccination site type plans. Even if, you haven't been working directly with them on some of those sites that they used for the flu clinics and flu shot clinics and stuff like that, still just a good idea to make sure that you have a good sense of, how you would look at implementing that, your volunteer registries, where you get your staff from, those types of things, just in case, it does come down that we need to use more of those pods than was originally anticipated by the department. So any questions? Oh, there's a question up there. Oh, there you go. Thanks, Brian. Appreciate that. So any questions on any of the things that I just covered there? Okay, move on to the next slide, please. Zippy little thing. Okay, go ahead, Eric.
Hey, good afternoon. Good afternoon, everybody. It's Eric from FEMA Logs. Just a couple things to go over. I know we talked about some of this in the various ISTs that were held over the last couple of weeks, but just want to reiterate some things and some things we're seeing. General points about resource requests. Obviously, as I said, I'm very appreciative that most of the counties have embraced the web EOC process. Again, we're working through some additional modifications on our end. Won't really affect what you folks see or do, but it will enhance how it works overall. Obviously, the resource request forms are still acceptable. One of the things we would appreciate is if you have non-emergent resource requests, if you could make them during normal business hours, during the day, Monday through Friday. That just helps cut down on sometimes confusion. If you're making an emergency request, make sure you note it as such and give the reason for the emergency. And those requests should also be emailed to S Logistics and to the state EOC. That's especially helpful after hours on weekends. The state EOC can notify myself or my staff then if we need to act upon something in an emergent manner. Remember, ask for capabilities, don't ask for things. And those other points there, sizes, amounts, locations, the typing, and the timing. Not only how long will you need it, but when will you need it is another important one. Go ahead, Rob. Now, specific to PPE and durable medical equipment. As Deputy Director Sevenson pointed out, you can use CARES Act funding for procurement of PPE. One of the things that you may want to consider alternate suppliers. Something we hear quite a bit is, oh, we're on back order or our normal supplier doesn't have it. You really have to think about using alternate suppliers and that sort of thing. And DCED does have that portal. Deputy Sevenson, do you want to touch upon Dan Scully's efforts here?
Yeah, so Dan Scully gave a call the other day. South Central has developed a system through the Everbridge system where they've loaded essentially all the vendors into Everbridge. They put a bunch of different criteria into it. I'm not a technical guy. Dan explained it well, but it didn't really stick with me. But basically, they can send out an Everbridge blast whenever they have, needs for looking for PPE purchases. And generally, they're doing large bulk purchases. He talked about gloves, where they're doing like 1 million gloves for that bulk purchase. So he did offer up if you're interested in what they're doing in South Central, you're welcome to give him a call. Eric can. If you drop Eric an email, he can give you Dan's contact information. But they seem to be having good success within the 9-county area of South Central Pennsylvania, and said he'd be willing to offer it up to any of the other counties throughout the rest of the state as well. Yep.
A couple other points specific to requests for PPE and durable medical equipment. If you're getting a request from a healthcare facility, or you're making a request for your county to backfill your county stock related to items you gave to healthcare facilities, please verify that the healthcare facility has been in communication with the Regional Healthcare Coalition and or the Pennsylvania Department of Health. We've encountered a couple times where either the county never called the Department of Health the facility never called the Department of Health before they came to you as the county. And in doing our research, we found out that the facility was in trouble and just didn't want to tell anybody. Or we've also found where the facilities will talk to the RICP will give them an allocation, so then they'll come to you for more. they're sort of playing mom against dad. And so we've got pretty good at trying to vet these requests out. So if you're submitting a request, ask them, if they submit a request to you, or make sure you find out if they have communicated with the RIC-P or the Department of Health, and please note accordingly what their response is. Many times we're getting requests that are coming in, and the caveat is, well, we have it ordered, but it's on back order. Understand if a county or a facility ordered something in July and the items are back ordered for delivery of January of next year, if we make that request now and try to purchase it, we're 4 months behind you. So really back ordering, if that's becoming an issue, again, look at alternative suppliers and things like that. The Department of Health Logistics, who works side by side with me, is looking at every request, and they have to vet it against our current inventory in our warehouse, and they may not fill all requests, or they may not fill the requested quantities, right? Because keep in mind, some of these items we don't have in our warehouse, and we review all the requests, and the requester will most likely, I'm going to say, it says may there, I'm going to say is most likely going to be contacted by either myself or the DOH logistics staff to vet the requests. We're finding out sometimes, we find out there's burn rates that are out of control with PPE, or, people, facilities are failing to use healthcare mutual aid and things like that. And that just, it makes it a little easier on us for decisions when we speak directly to the requester. So if you need Dan Scully's information, you can email me and I'll get it out to you in a day or so.
Any questions for Eric?
Hey, good afternoon. This is Rob. I just talked to you real quick about WebEOC. Back in the spring, as you know, we gave WebEOC access to all the counties. Since then, we had the general election, and we gave access to the general election incident to all the counties as well. So I mention this because it's very important that you're logged into the correct incident when you go into WebEOC. So if you log into WebEOC to maintain situational awareness on what's going on, or you need to submit a resource request, when you log in, make sure you're in the 2019 novel coronavirus incident. That's very important, because if you log into the wrong incident, you'll have the wrong information, you'll see the wrong information, and our logistics folks will never see your resource request. So make sure that you're in the correct incident. And if you've had any new folks that joined your agency since the spring, or someone needs their password reset, or you just need a quick 101 on WebEOC again, reach out to me. My email is on the slide, and I'd be happy to assist. Thank you. Any questions on WebEOC? All right, thank you.
All right, this is Mike Manley again. We'll talk a little bit about reporting requirements. As you know, we talked through this whole brief with this expected surge and its effect on resources. The more timely and detailed information that we can receive from you, the better it's going to be for our decision making, our ability to allocate resources properly, and to make timely decisions. The important aspect of that is, well, in your particular county, you might think, well, we have some small things going on. They're not that important. Those one or two small things coupled together with 66 other counties, small things can be really impactful on the resources that we can help assist you with here at PEMA. So it's important that we get the information from you as much and often as possible, and as detailed as possible. And that's where it comes into our CIRs and EEIs, critical information requirements, and our essential elements of information. If it's a critical piece of information, we ask that you you email that to our SAS01 inbox immediately. If it's really important, follow that up with a phone call, and also put that into WebEOC, as Robin said. It's really important, even if we're going to send out a new list of CIRs and EEIs, an updated list. Even if something's not on there, you feel it's important, don't worry about our list, worry about the impact that has on your county, and get that information to us right away so we can take action on it and assist if required. Same thing with daily situation reports. If you're producing situation reports, please submit that into WebEOC daily so we have that. If you have an issue with getting documents across WebEOC, then email them to that SAS inbox. What we're trying to do is ensure that you have all the latest information coming out of PEMA, and we're going to make sure that's continually uploaded to the county hub site so you have the latest information. When we update those CIRs and EEIs, we'll be loading that up on the county hub site as well. One of the things that we are working on to enhance your decision making at the county level is to create we are in the process of creating with Benier Solutions, a contractor since July. We've been working on situation awareness GIS dashboards that are in an all hazards framework that can aid in decision making. And we expect to have these live sometime in the not too distant future to provide real-time data as opposed to a situation report that might be 24 hours old and is not providing you with a quick decision-making tool. This will give you the information basically as soon as we get it and allow you to make timely decisions. Anything you'd like to add to that?
Yeah, you can just grab Luzerne's question on the hub, where they would get their credentials restored to the hub.
Yes, if you have issues with getting to the hub, or you want to add any additional people to the hub site from your county, please send a list through your area office with a name and their email address, and we will work to assist you with that, to get you onto the hub.
Okay, thanks. Any questions for Mike on reporting requirements or the hub or any of the SA tools? Okay, so yeah, I wanted to give enough time to answer any questions you guys may have as we come into the fall. I won't guarantee I can answer them, but you know, if we can't, we'll take them down and try to get an answer to your questions. So kind of open it up for any questions then. We can unmute you if you want to talk or.
And you can unmute himself now.
Okay, so if you have a question, you can unmute yourself now. Okay, well, it doesn't seem like we have any questions, but if you do, like I said, just drop an email either to your area office or through SAS. It'll get to us and we'll get it to the right people. So with that, I'll turn that back over to Tony for any closing comments.
Yes, thank you, Tim. I just wanted to throw one thing out there, and I asked a few folks during the first wave of this for the need for a weekly conference call. I think, you know, looking back on it, I think it would have been a good thing to have at least some time devoted the same time every week for a short, focused conference call to hit some of those things that you know, we may need to touch on, and I would like your feedback on that. My vision would be short, focused call, same time every week. Could be anywhere from 15 minutes to an hour, depending on what kind of complexities we're dealing with and what information needs to be shared. But I think based on some of the experiences in Central and Western area, I think those type of calls were beneficial in those areas. We kind of kept it more for the email and ad hoc meetings, but I think we could have used something that was regularly scheduled, and if nothing else, a touch point once a week for all the counties to ask maybe some questions that they didn't get a chance to during the week. So if you can email me your thoughts, again, it'd be short, focused, and it would expand our contract based on what we're facing that week or, you know, the coming weeks. But if you can send me your thoughts on that, looking at probably start scheduling something here next week or the following week, and then make it a recurring same time every week. Other than that, I want to thank you for your time this afternoon. I know, it's been a busy day for a lot of folks with, conference calls. You need anything, we're here at the area office, give us a call, and we'll do the best we can do to help you. Any other comments from headquarters, sir?
No, thanks, everyone. Have a great, happy Thanksgiving, and appreciate all you're doing out there. Thank you.
Take care, everyone. Happy, Thanksgiving.